Okay, so I'm back. Sorry about that. So we'll continue where we left off. So respiratory portal of entry. So you get the greatest number of pathogens entering this way, and that's because the lungs are fairly large when you look at them at a surface area, from a surface area's perspective. There's a lot of surface area within the lungs, and that's important for absorbing as much oxygen as possible, but with that, it allows great areas for pathogens to get in. Also, the skin in the lungs are very, very thin, or the tissues in the lungs are very, very thin, and that is to allow oxygen to assimilate. But it also allows for an easy entry point for a lot of pathogens. You can see a great number of guys down here. We'll talk about these in more detail, but whooping cough, influenza, measles, things that you've probably heard of before and associate with the respiratory tract. Your genital portal of entry, so this is a perfect place to enter if you're a pathogen, primarily because organisms need to have sex to survive, so why not manipulate that? They also have a very good ability to cause asymptomatic infections, and that is where you're infected but you show no symptoms. And if you're an STD, that is the perfect situation to be in, and that's because I wouldn't want to have sex with someone who was oozing stuff out of their vagina, for instance. Instead, I'd have sex with someone who looked normal, but then I would get infected because they were actually infected but not showing any symptoms. And these guys have a remarkable ability for being able to do that. They enter via the skin, mucous membrane of the penis, external genitalia, vagina, cervix, and urethra, and so forth. All of these areas have usually thinner skin, making it easier for things to penetrate through. They can also penetrate unbroken skin or unbroken surfaces, but generally some microtrauma does need to occur for the guys to get in. Some examples of these: syphilis, genital warts, chlamydia, herpes, gonorrhea, the list goes on. There's a lot of them. You can see the sexually transmitted diseases happen on a fairly regular basis throughout the United States. HPV is by far the most common, but you have trichomonas, chlamydiosis, herpes, gonorrhea, hepatitis B, AIDS, syphilis, all pretty high up there on the list. Pathogens that infect during pregnancy, so this can be somewhat problematic. A lot of these pathogens aren't that serious in a healthy individual who's not pregnant, but as soon as you become pregnant, your child becomes a target. A good acronym to remember these is TORCH. So toxoplasmosis, other diseases, rubella, cytomegalovirus, and herpes simplex virus. Toxoplasmosis, rubella, cytomegalovirus, and herpes simplex virus are all very, very, very mild, especially in healthy adults, but as soon as you become pregnant, it becomes serious for your child. Generally, you need to become infected with these guys for your very first time while you're pregnant at a very specific time in the pregnancy for it to become serious. That's why you don't really hear of it that often, because it is a fairly hard thing to do. These guys have the ability of crossing the placenta, so in general, mother's blood is separated from baby's blood by the placenta, and these bacterial cells in this case, or some viruses, or even some parasites, have the ability of kind of breaking through the placenta and getting into fetal blood. That's when the problem occurs. So size of inoculum has a lot to do with how serious an infection is, at least in the initial parts of the infection. Some microbes need just a few individual bacterial cells to cause a severe infection. Others need a lot. It just depends on the microbe, depends on how they infect, depends on their virulence factors, depends on a whole bunch of stuff. But for most agents, infection only proceeds if the infectious dose is present. So that is the minimum amount of the infectious agent to cause a disease. And microorganisms with smaller IDs have greater virulence and are more pathogenic. That just makes sense. So once you get in, once you find a portal of entry, you now have to kind of set up shop. And to do that, you need to attach. So to attach, we've talked about this before, you can use things like fimbriae, capsules, or spikes. This allows you to attach to the surfaces you want to be, and you can just sit there and sop up food. Here's a quick list of some guys and how they attach. You can look at that at your leisure. Now you have to establish your infection, and this is surviving the host defenses, or step 3 of our infection story. So the very first thing you'll encounter, at least from the host immune system, would be phagocytes. So these are the vast majority of white blood cells, and their primary goal is just to gobble up, destroy pathogens, along with any other kind of debris that makes its way into the body. To combat this, pathogens have come up with things like these antiphagocytic factors. Leukocidins, so these are toxic to white blood cells. So obviously if you kill the white blood cells, they can't phagocytose you. That works out well. External surface layer, so your slime layers, your capsules, your biofilms, makes it very, very, very hard to phagocytose because you can become too slippery. And once you're slippery, the bacteria or the phagocytes can't grab onto you enough to pull you internally in. And then some don't even care if they get phagocytosed, they just survive inside the phagocyte. Things like Legionella, Mycobacterium, and many rickettsial organisms. So tuberculosis is a prime example of this. It becomes phagocytosed by macrophages, which are phagocytes in the blood supply. And here they've stopped the fusion of special lysozymes in the macrophage that would normally digest them. So by stopping this fusion, they stop the digestion process, and then they just kind of hang out inside of the phagocyte. So how do they cause disease? You use your virulence factors to break down tissues. By breaking down tissues, more nutrients are released and you get more goodies. So exoenzymes are a good example of this. This is where you'll have your bacteria releasing enzymes that degrade things like plasma membrane or cell walls, and this allows for the bacteria to kind of kill the cell, take up its nutrients. Toxins just shut the cell down. Once the cell shuts down, it releases its goodies. And then you can also block phagocytic responses. So extracellular enzymes, they break down and inflict damage on tissues or dissolve the host defense barriers. So mucinase breaks down mucus. So by breaking down mucus, it stops the mucus from doing its job, which is to kind of slow the microbe down. Keratinase, this breaks down keratin. You break down keratin, you get through the skin. Coagulase breaks down collagen. Collagen is found as a good connector between cells. And once you break that down, that connection breaks and those cells become easy to access. And hyaluronidase is hyaluronic acid is a acid motif found in almost all cells' plasma membranes. As soon as you break that down, you break down the plasma membrane and you can take in whatever that cell has inside. And then some react with components of blood, so coagulase is a good example of this. This actually causes blood to coagulate. And kinases, these break down kinetic activities within the blood. So bacterial toxins, these are specific chemicals produced that is poisonous to other organisms. These aid in the killing of the host cells. By killing the cells release their goodies, the bacteria get to take in all the goodies. So toxogenicity, this is how powerful a toxin is. Toxinosis, a variety of diseases caused by toxogenicity. Tetanus is a good example of this. The disease is not caused by the microorganism directly, instead it's caused by a toxin the microorganism releases. Toxemia, so toxosis in which the toxin is spread by the blood from the site of infection, so tetanus and diphtheria is another example of these. Once it gets into the blood, it's downhill from there. Your blood just kind of spreads it all over and then it can cause systemic death. And intoxication, so this is toxoplasmosis caused by ingestion of toxins. Botulism is a good example of this. There are also a few foodborne illnesses that are caused this way. So endotoxins and exotoxins. So exotoxins are actively released by the cell, and these are used to break down materials within the host. Endotoxins, on the other hand, are toxins that are only released after the bacteria dies. So they're bits and pieces found within the bacteria, and then as soon as the bacteria dies, those bits and pieces get released and cause a toxic effect in the cell. So they both have slightly different functions. Exotoxins are used for actively dividing bacteria. They're used to kind of help a bacteria get its nutrients. Endotoxins are primarily used to aid your friends, because as soon as you die, you're obviously not going to be, taking up any of the goodies that you're causing to be released. Instead, you want those goodies to be released so that your neighbors have a better chance of surviving. So exotoxins actively released. Endotoxins are found usually within the cell wall or inside of the bacteria, and they're not released until the cell dies. So this is a little bit about an AB toxin. We'll talk in more detail on what an AB toxin is, but an AB toxin basically has two units. The B unit is what allows it to enter the cell. It kind of sends a trigger in the cell to say, hey, take me in, internal. And then the A unit breaks off and then causes some kind of toxic damage to the cell. And we'll talk about this in more detail later. So the process of infection and establishing disease. So establishment, spread, and pathogenic effects. Microbes eventually settle on a particular target and organ and continue to cause damage at that site. So microbes usually have a preferred place they like to be. Once they get into that place, they settle. That's where they set up shop. They start releasing their toxins. They start releasing their exoenzymes. They start breaking down tissues so they can get their nutrients. This frequently weakens host tissues, which can be, again, problematic. You don't want your tissues breaking down. That's what they're there for. They're meant to be intact, meant to be strong. As soon as they get broken down, bad things happen, such as necrosis. And this is the accumulated damage of cell tissues that can eventually lead to tissue death. So establishment and localization of infection. So the most simplest infection would be a localized infection, and that's where it just stays right in the area of entry, so right at the portal of entry. These are things like pimples, boils, generally more mild, but there are some severe ones. Things like MRSA, for instance, can be a localized infection but can spread, and that's when it becomes problematic. A systemic infection, these can be a little bit more serious, and that's where you get things migrating into the blood, and then they can kind of be transferred throughout the body. Focal infection, that's where you have something that was localized at one point, but then it transfers itself to the systemic region, usually by co-infection. Mixed infection, this is where you have many different microbes in one area. And then primary and secondary infection. So a primary infection is where you get infected with something, and that weakens the immune system in that area, which allows for a secondary opportunistic infection to occur that normally would not occur. So now we'll talk about a little bit about causing disease, but this is basically the 4 steps, or the 4 steps that we've gotten to so far, but the 5 steps total of what a disease is. So it's finding a portal of entry, so breaking through the skin, getting through the GI tract, getting through the respiratory tract, and so forth. Then you're attaching firmly to the area that you want to set up shop in. Then you survive the host defenses, combat the immune system, stop phagocytosis, protect yourself. Then you start releasing your toxins, you cause damage, you break down tissues. By breaking down tissues, you get more nutrients and you survive, you reproduce. Once you reproduce in significant numbers, then you can start exiting the host. So if you don't exit the host, then as soon as your organism of choice that you're infecting dies, so do you. So you need to have the ability to kind of release yourself into the environment so that you can spread. So the progress of infection. So this is this little bit here, the causing disease and damage. So once you get through all of this stuff, this is when you actually cause the disease. And these are the different stages of disease, at least from our perspective. So the first bit is the incubation period. The incubation period is where you have fairly low numbers of microorganisms present, usually not enough to cause that many symptoms. It's kind of like the getting stronger period. It's where the microorganisms are dividing, they're getting used to their environment, they're kind of setting up shop. Next, you have your prodromal stage. So your prodromal stage is where you have a critical number of bacteria that can cause pathogenicity, but it's not the number needed to cause the actual infection or the symptoms associated with that infection. Instead, you get some symptoms, but they're different symptoms. So this is generally seen as kind of like a malaise or a sleepiness or being tired, or that general ickiness feeling you feel like when you're about to become sick. That's the prodromal phase or stage. It's where the pathogen is beginning to set up shop, it's beginning to become pathogenic and cause disease. But the symptoms aren't the symptoms associated with that disease normally. Then you get into this period of invasion where you get a heightened amount of symptoms, and these are the symptoms that are associated with that disease. So if we're talking about a cold in this example, your incubation period you feel no symptoms at all because you only have a few virus particles in your respiratory tract. Those virus particles then divide, or infect, become many more viral particles. Those viral particles then start to cause some symptoms, but these symptoms aren't generally associated with a cold. It would be things like getting tired or being sleepy or just generally feeling icky. Then, during this period, you have more and more viruses. Those more and more viruses can infect more cells. That's when you get the actual symptoms of the cold, so you get the runny nose, the headache, all that good stuff. And that's when you get the height of your infection. Then your immune system kind of takes over. Your immune system starts to fight off the infection. And then as the infection gets weaker and weaker, thanks to the immune system, the symptoms get less severe, and this is called the convalescent period, until you fully recover. Now there are always people that are going to be chronic carriers, and these are people who always have a small number of microbes in their body, usually too small to actually cause any of these symptoms, but they're always present, and for that reason they can be transmitted. So a sign is any objective evidence of a disease as noted by an observer. So a sign is something that can be physically seen by an observer. So you look green, you have jaundice, your heart rate has gone up, that kind of things. Things that can be measured by a physician. A symptom, on the other hand, is the subject evidence of a disease as sensed by the patient. So a symptom would be things like, oh, I have a sore throat that can't be seen, or I feel achy. That can't be objectively seen by a doctor. It needs to just be described by the patient. And then a syndrome, this is when a disease can be identified or defined by a certain complex of signs and symptoms. This is what makes a differential diagnosis work. So by saying a cold has this, and this sign, this symptom, and so forth, we can say, okay, if anyone gets those signs and symptoms, they probably have a cold. So here are some signs. You can see fever, septicemia, skin eruptions, leukocytosis. All these things can be measured by a physician. Then you have your symptoms, your chills, your pains, your malaise, your fatigue, chest tightness, itching. All of these cannot be measured by a physician. You just have to go on the patient's word. Signs and symptoms of inflammation. So you get fever, pain, soreness, swelling, edema, or buildup of fluids. Granulomas and abscesses. So granulomas are where you get white blood cells kind of walling off an infection, and they cause these nice little kind of lumps of white blood cells. And if they get large enough, you can get something like an abscess, which is just kind of a huge lump of white blood cells. Lymphadenitis, this is where you get a swollen lymph node. This is primarily because the lymph nodes are used for collecting and draining activated immune cells, and for that reason they get larger during an infection. And then lesions, this is the site of infection or disease.